More than 3,000 new cases reported in Arizona. Several Valley hospitals going into surge mode this weekend, making extra room for a growing number of coronavirus patients. Let's get right to our Adam WALTZ. He's talking with doctors about what this means. Adam?
The next step to preserve medical equipment may just mean a death sentence for some patients, and it will be the decision of the doctors and healthcare workers to decide who may just get that life-saving treatment. Crisis standard of care is what's on the table as a last resort for doctors.
Deciding who gets care and what care.
Arizona hospitals have asked the Department of Health Services to adopt a crisis standard of care which prioritizes medical supplies to patients with a better chance of survival or who may have more to live for.
A single mom with no medical problems versus a 65-year-old whose kids are all grown with pre-existing medical problems, they're going to have to choose between those.
Many hospitals have already implemented surge plans, something Dr. Wilson said could have been avoided.
At least 2 months of lead time to learn and gain knowledge and learn how to prevent this from happening. And Governor Ducey and Dr. Christ had the power and the knowledge to prevent this from happening in Arizona.
It's all COVID all the time.
We interviewed emergency room physician Frank Lavecchio in April about COVID. He says his mindset has changed in 2 months from education to survival.
When this was out in April, I'm a researcher, teacher, and I was trying to figure out a way to, save the world and cure everyone of this. And I just want to get out of this thing alive.
The crisis standard of care is undergoing review from the Department of Health Services. If approved, tough decisions will have to be made based on the lack of supplies.
It's going to be devastating for anybody that's involved in any of this. But when we have crucial shortage of resources, that's why you have to do. You don't have a choice.
As of yesterday, AZDHS reporting that 87% of hospital ICU beds are in use. Danielle?
And Adam, we know the state has been working to get St. Luke's up and running to try and help with COVID-19. So are we going to see that opening anytime soon?
Well, Danielle, no plans for it yet, but it is on standby. That's what state health officials say. It's on standby if it's needed. They have a vendor on standby to run the facility, and if it does open, it'll most likely be a step-down hospital for those recovering from COVID-19.
All right, something we will be following very closely. Adam WALTZ with that update for us tonight. Thank you, Adam.